Welcome to The Dental Brief, the podcast that delivers actionable insights and expert strategies to help dental professionals like you grow, lead, and succeed. I'm your host, Patrick Shavasty, the president of Omni Premier Marketing. Every week at The Dental Brief, we bring you real conversations from expert speakers that offer expert advice and quick tips that make a real difference in practices nationwide. Whether you're a general dentist or run a multi-location practice, we've got you covered with content that's designed to help you attract more patients, to streamline your operations, reduce headaches in managing your practice, and increase your profitability. If you're ready to elevate your practice, be sure to subscribe, hit the notifications bell, and let's dive into today's episode of The Dental Brief. Hello, everyone. Welcome to another episode of The Dental Brief. I have with me my co-host. I say that because I think this is 6 or 7 times she's been on the program. Brandi Hooker Evans, say hello to everyone.
What's up, everyone? So fun to see you, Patrick, and be co-hosting with you today on the Dental Brief podcast.
Yeah, I literally think maybe we should talk about that. I think maybe we have a little bit. Glad to have you on the program. You're always so upbeat. We're having a great offline conversation about what my friend Eric Vickery calls, what is it called? Approval addiction. Yeah, approval addiction. It's such a great term in dental practices. So it's kind of fun talking about that a little bit. What brought you on the show today, Brandi? What do you want to talk about today?
Well, I think that we all need a good reminder about connecting to the human in each and every one of us and human to human. We've been talking about wanting to be approved, and there's some amazing AI technology that has come out and has been able to make diagnosing, whether it be medical or dental, it's like you said, a second opinion. And what I am hoping to breathe life into our communities is, yes, second opinions are great. And what if we teach our patients how to listen to themselves, how to look at their x-rays and their perio chart and the intraoral cameras, and to evaluate what's going on in their mouth and their bodies so that they can say, oh, I am a living, breathing human being that has needs. And so that's what I'm hoping to dive into a little bit today. I think we've got to tap into our humanity so that we can endure or embrace, depending on what you want to use, all of the technology that's swarming us at the same time.
Yeah, I think it's a heck of a subject. A couple of things about that. You know, I just read a book on, I wish I could remember the name of it, but that it talked about in conflict situations, people not looking at people as humans. And if you just stop, somebody says something, does something, or doesn't say something or doesn't do something, and it hurts you, it upsets you, it makes you angry, frustrated, whatever those feelings may be, stop for just a second and look at them as a human being, and it'll totally change your perception, right? You'll start to understand that it's a person and not some weird dark force that is coming at you, right? And then also the 6 human needs, I think this is from Tony Robbins or something like that, are like certainty, right? Some level of uncertainty, variety, significance, connection, love, growth, contribution. And I think those things are all those fantastic. So give us some real world examples of where and how you can connect as a human to other humans in your practice, not just a mouth that needs treatment.
Well, I see a lot of us, and I want to just say us because I think we're all guilty of it at one time or another, but treating the patients like they're naughty kids that aren't doing what they're supposed to be doing.
Yeah.
And we remove their autonomy, we remove all of the life experience they have that led them to that chair. And I don't mean to excuse away disease or bad behavior, but the reality is that no one is perfect. And if we're brave enough to show up to the dentist, how nice would it be to be given the tools to not only have great care with the practitioner, but also to go home and be equipped to take really great care of ourselves. And the way that I think that we can do that is by scooching the judgment portion of our brain out, the portion that is saying, I have 8 patients today where I'm going to have to reprimand them about how they're not flossing because their gums are bleeding.
Right.
and show up and just sit and be present with each patient. If you're coming in to do the exam as the doctor, just come and be curious. What's going on in this patient's life? What's going on in their mouth? And how can we educate them to make their own decision about what they want, not only for this moment in the chair where we want them to like us and we want them to do the treatment and we want them to come back, but rather, here's what health is. Here are the outliers. Let's look at your mouth. How's it going? What's going on in your life? And say, hey, I'm here and I'm with you. Yep, this is hard to create a habit. Whatever the thing that they're struggling with. I mean, obviously from my chair, so often it's bleeding gums that is actually an inflammatory process that is circulating through their entire system every day, all day. And it breaks my heart when I see dentists and hygienists show up, reprimand the patient leaves, thinks that they're in trouble for not flossing, is absolutely not going to start flossing. And we still have that beautiful human being that's walking around a blinking inflammatory process because we didn't take the time to truly sit next to them and figure out how we can get inside of their brain and their psyche and help them pick a better road for themselves. And I do say better because you know what? Inflammation is not going good for anyone. Folks, we're losing more people to cardiovascular disease. There's more chronic, non-communicable diseases in the entire world than there ever has been before. Cancer, depression. I mean, and people don't realize that inflammation that's going in your body is altering the signals that the bacteria in your gut are sending up to your brain that tell you which hormones to release, that tell you how to feel. You know, like, do you feel good or do you feel bad? Well, it's an uphill battle if you have infection in your mouth, even if it's, quote, just gingivitis or periodontitis, it doesn't matter. It's affecting the human on such a molecular but also cosmic level. And so I think that's the invitation, Patrick.
Yeah. A couple of things, from not being in the clinical side of things as you are and so many of our listeners are. I'm certain, first of all, one thing that I know that I never see talked about in the dental community, I know this from my marketing background, studying marketing, that literally the only reason why most people, and I'm not talking about people that are very healthy, the people that go to the gym 6 days a week and that are eating right and all of those things, they're going to brush their teeth for health reasons. The rest of the population is brushing their teeth out of social pressure. People don't realize that. Like the early toothpaste commercials and ads, Listerine, actually, their first ads was a picture of a woman that said, always a bridesmaid, never a bride. And it was basically saying, hey, you got some funky breath, and that's why you're not getting married, right? So it was a social pressure. That's for real. That's the first Listerine. That's where that is where that saying was coined, was a Listerine commercial, right? Always a bridesmaid, never a bride, because your breath stinks, right? It didn't say your breath stinks part. I added that for fun, but that's really where it came from. So go ahead and Google it. So they were putting social pressure on people saying, hey, take care of your mouth, because of the way that you're perceived by other people. It had nothing to do with your individual mouth. So take that and then bring it to today. I'm a big believer that somewhere around 40, I don't know what the number is. And again, I'm making this up, but I believe it's true, that once you get over the age of 40, the number one reason why people don't go to the dentist regularly at that point, it's usually not income for most people. For some people it is, but for most people it's not. It's the reverse effect. They don't want to come in and show a room full of people that they haven't been taking care of their mouth, because they feel that social pressure, that judgment. They have approval addiction themselves, right? I don't want to be judged. And so think about when they come in for the first time, or even before they come in. That might be a better time to start thinking about them. Why aren't they coming into the practice? Well, because they're always a bridesmaid. And the reason why they're always a bridesmaid is because they got some funky stuff going on. What do you think about that, Brandi?
Well, I think it speaks to so many more things than just their teeth. People are ashamed of their weight. They're ashamed of their teeth. They're ashamed of their financial profile. Like,
right.
All of these things based on neglect. And so I think that's how, as professionals, whether you're a clinician or not, that's how we can help. Like, sit down and scooch that judgment part of your brain out, or even channel the part where you've made bad decisions and you hope that your final judgment isn't based on that worst day of your decision making and choices, and really sit with them and create this place where there isn't shame. And, one of the things that I love to do when someone has periodontal disease is get excited and celebrate. I hear so many of my colleagues say, oh, well, we're going to have to do scaling and root planing if this doesn't get better. And you can hear that, like, I am so mad at you. You're going to be in trouble. And this is so bad.
Right.
Oh, now we have to do scaling and root planing. Oh, now I have to get you numb. Oh, it's so bad. And I say, hey, Patrick, I am so glad that you are here today. I know that it sucks to have gum disease, but here's what we can do.
Right.
And then we rattle off like how getting a little extra sleep or going for a walk after work is going to help your gums heal, right? Because I'm trying to change the conversation. I don't want them to think that they need to brush and floss. They know they need to brush and floss. I don't need to say that. And get the conversation changed and be like, gosh, I am so glad you're here today. Thank you. And I tell this to my patients all the time personally. I say, I am so glad I'm the one that got to be the one to take care of you today. Thank you for being here.
Yeah, it's great.
And it's in the middle of, like, instead of $100 preventive cleaning, they need $1,000 treatment cleaning. And instead of being mad at them and judging them and making them feel like they've got to do this treatment or they're going to have to sign this big declination of service form being charted all, and like, no, Patrick, I got you. My arm and your arm, we are linked up and we're going to do this.
Right. What a difference. I mean, seriously, what a difference. I mean, to know that you have a partner. And I mean, that is what people keep talking about, what they want more and more and more, right? People want to feel like they have a partner and these types of things, right? When you talk about, medicine and healthcare, people always want to choose their doctor. Why do they want to choose their doctor? Because they want to feel like they have a partner in it. That's why they don't want to go from doctor to doctor to doctor. Even though those doctors are more, quote, skilled or experienced, they still want to be with like their partner on that. So that's absolutely, I think, brilliant and important and something that people really need to do. So let me ask you this, Brandi. And I think I know the answer to this, you're always in a great mood, right? That's what I always see. And I'm sure there's moments of time in the day where you're not, or the week or the month or whatever, right? There's always those times. But how do you get yourself in a good mood? Like, how do you decide that you're going to be so outgoing, positive, great energy? How do you do that?
Well, two things. One, this is the way that I was made. I really believe that God put me on this earth to be love and light, and my job is to inspire. And part of that is, if I'm tapping in and being quiet, like I shared about my patients, and really figuring out my journey is not to be up to date on whatever the news might want me to know.
Yeah.
And so knowing my purpose to be positivity and love and light, especially when it's hard. I know the things that are going on, but I don't scroll and keep myself up to date with the latest drama. And that makes a huge impact on my ability to inspire those around me to have a positive outlook. And the other thing that I have seen be taught and retaught over again for, quite frankly, in my research of the world's history, thousands of years,
Sure,
is a practice of gratitude. I know that today is going to bring challenges, and I'm excited I get to breathe. And when something hard comes up, I know that there's a human in my future that I'm going to be able to serve and help them get out of this deep, dark pit that I was in, because I was in this particular pit. And my job is to figure out the tools that I need for myself to get out of it, that are then meant to share with the people behind me. And I know that if I can keep showing up with my purpose, my job is to be kind and hopeful and grateful, that whether it's a celebratory day or I'm learning how to dig myself and teach other people how to dig out of the pit of hell, then it's all for something. And when you said earlier today, people who have jobs that are being discarded by AI, let's say,
yeah,
when more people lose a sense of purpose, we're going to see more depression. And
Right.
so my job is to inspire myself and the people around me to live into their purpose. Because if you're living into your purpose, it doesn't matter if you are housekeeping, janitor, president of the United States, president of another country, the Pope. I mean, it does not matter. But if you are living into your purpose, you're making the biggest difference in the world just by being you with your unique experiences and gifts. And so that's my job, and that's how I keep it up. And I have a couple of people that I can piss and moan to and snot cry when necessary, and that helps too.
Yeah, I think the gratitude is so underrated. I mean, it's just something that is so important to do, and that we should all try to remember and set a reminder to do it. Just 3 things that you're grateful for. I like to think of things that I had no impact on, that had nothing to do with me, that I didn't create, that I didn't do, that just happened. Right. So I think that's a great thing to do. Website, brandihookerevans.com, links on social, YouTube, Facebook, all that stuff. But go check it out. Learn more about the coaching that Brandi offers and what she does to bring that energy to practices across the country. Brandi, thanks so much for being here. We really appreciate you.
Well, thanks for letting me co-host. I'll look forward to our next session.
Thanks for listening to this episode of The Dental Brief. If you found it helpful, give it a thumbs up, subscribe to the channel, and share it with a colleague who could benefit. We're here to help dental professionals like you stay ahead of the curve, one brief episode at a time. You can find more episodes and resources at thedentalbrief.com. You can also join the Growth Minded Dentist community on Facebook. Links are in the description. Until next time, keep learning, keep growing, and thanks for being part of the Dental Brief community.